All right, everybody, thanks for coming out tonight to the May 14th Board of Health meeting. I think we'll start with roll call. If we could just go around the room, I think since there may be people watching us on Facebook or may not be watching us on Facebook, it'd be nice to just give a little bit of an update of who we are. So maybe you can give your name, how long you've been on the board, and then maybe just a quick bit about yourself. Start with Al. We'll go around.
Okay, should I start?
Sure.
All right, well, I'm Harold Etzel, president of the board. I am been a resident in Upper Chi for 40 years. Currently involved with the Board of Health, Emergency Management Committee, Chichester Seniors, and various other activities around town. I guess I'll put it that way. My background is primarily business. I spent 25 years in the cable industry. Prior to that, I was actually in the space industry. And following that, I was a defense contractor involved in many ways with teleconferencing and distance learning. So I think that does it for me.
Great. Byron?
Byron, you there?
Byron Brack, the Board of Health for a number of years. Resident of Chichester since 1995, so it's been a number of years as well. Right now, I'm currently in the industry for seniors, medical alert systems, but have been a long working employee in the industry of insurance, just here to serve the community and do all I can for the residents of Upper Chi.
Great. And Dr. Goldberg?
Dr. Goldberg, board certified family physician in private practice in Upper Chi for heading towards 40 years. Member of this board for some time, now more active, that the board's more active and involved in things.
Nice, thank you. Michelle?
Yep, Michelle Finelli, Assistant Health Inspector for Upper Chichester, 10 years, resident over 20 years, paralegal, and I'm happy to join.
Thank you. Wayne?
Hi, Wayne Martin. I've been a resident for 25 plus years. I've been in the IT business for all of my career. So I'm happy to be here, and thanks for putting this together, George.
Doing my job. Thank you. Thanks for coming out.
You're welcome.
Darren?
Oh, sorry, I had to unmute. My name is Darren Anderson. I've been a resident here in Booth Wynn, Upper Chichester for 10 years. Moved from Delaware by the way of Texas. I've been a public health kinesiologist for 20 plus years. I work currently with the YMCA and just got off the phone with the Department of Health, having conversations about COVID-19, perhaps testing, saliva test in children. So I just got off the phone with our infectious disease epidemiologist who's consulting with us. So we're kind of knee deep in this, and I'm glad to have this conversation today with you all.
Thank you. And my name is George Needles. I'm the township manager here in Upper Chichester. With the township for a little over 4.5 years. And I've been with this board directly for, this is our second year we're all together. Really enjoying our time together. You know, as everybody on this call remembers, last year we did a pandemic exercise, and who would have thought that, you know, 6 months later, this would be something that we were facing. So it's good to, you know, it's good to be able to practice. It's a shame we have to, you know, have it in reality.
Right.
So with that, I think it's worth going into our COVID-19 discussion. What I was hoping we could see is kind of give everybody like a little insight in how it's affecting us professionally and personally, you know, and then we can wrap up with kind of where we're at with the township and what we've been doing. So I think, do you want to start with Dr. Goldberg?
Well, it's for one thing, changed the nature, the scope of medical practice. I think pretty much every practice in the county in the United States and probably elsewhere now moving towards or is in telemedicine, doing video conferencing, Zoom meetings, FaceTime, Skype, whatever can be done in order to communicate with patients safely, keep people that are higher risk from going out, and even people at low risk to enable increased social distancing to keep them safe to be able to have medical visits through technology. It's not the same, but in pandemic and emergency conditions, it's something you have to do. So that's certainly a big change.
Thank you. Michelle, do you want to talk a little bit about how it's affecting inspections and?
Yeah, yeah. Yep. So since March, I guess a couple days before we were all stay at home, I completed quite a few inspections, but after that, contacted the state and they said to stop. So it's really affected my world as far as food. So a lot of restaurants either closed down, then a lot opened up with the curbside. So while everyone's on a year rotation, was in contact with the state as far as concerned with the ones that were doing curbside that were over the year. And they called me back and said, yes, definitely go in and very cautiously and safely. So it's affected my world tremendously as far as I didn't used to contact people saying I was coming because you should be a surprise inspection. But now being cognizant of the gloves and the masks, we now contact them and say we're coming early in the morning while it's empty. Most of the restaurants that are opened over a year, so we'll probably be behind in some of them that aren't open. But we have a lot of direction from the state. State's been in contact with me all the time through email, so it's changed my world tremendously.
And just a quick kudos to Michelle. I mean, she still gets the complaint calls that come in, the concerns, and she's been doing a really great job handling them and handling them effectively with all this. So good job, Michelle. You always do a great job. Thank you.
Thank you.
Darren, do you want to talk to us a little bit about how your role in public health, what you're seeing?
Well, we're seeing a number of things. My office is in New Jersey, and New Jersey and New York is at the epicenter, what's considered to be ground zero. I think there's two things that we've been having conversations about. Number one is that we have 15 YMCAs throughout the state, including a YMCA in Greater Philadelphia. They split New Jersey and Philadelphia, so I work with all 33 associations. We're providing emergency childcare. We are following all the public health guidelines. We have school nurses that have stepped up and they're providing temperature checks. And if we have quarantine protocols in place, if someone was to test positive or they would have the symptoms, then we would quarantine them, and then we would have to contact our local Department of Health, and then they would begin a process, I guess, around contact tracing. We're having conversations now because they're looking at phase one of reopening, and our working families need support. We're learning that a large percentage of families that want to return back to work cannot because they have no place to send their children. So we're working on developing standards and procedures. In fact, tomorrow there should be a guideline that's going to be released by the Centers of Disease Control in concert with the American Camping Association and with the Environmental Health and Engineering, if the White House allows it to proceed. So there will be guidelines, robust guidelines that everyone can follow. So providing these essential services has been really has been the root of the majority of our work, and in feeding programs. A lot of children, because schools are out, are not getting the meals and the food that they need. We're working with community food banks all across the state, as well as here in Pennsylvania. There's a number of children that actually are house insecure, that live outside of their school district, that lives in hotels. They have not been serviced. We've learned perhaps it could be close to 13,000, and we're thinking could be about 3,000 that live in the greater Philadelphia area as well. So that has been an eye opener that childcare, feeding program, and housing has been an issue that we have been addressing. And later on, we're having conversation about, since children are in our custody, for lack of a better term. Testing. So we're trying to understand which direction that's going to go.
Great, thank you. Wayne, do you want to talk a little bit about how it's affected your work life right now?
Yeah, right now, and just like any corporation in the IT world, we're trying to maintain and keep 200,000 plus worldwide employees working from home. So that's been a challenge. We don't know when we're going to get back to the office environment. Some of our offices, the newer ones, are the new modern office setup where we're work pretty close, and we probably can't go back to that environment now. So it's going to be a challenge to kind of reconfigure office space now and see what happens. But for the foreseeable future, we're mostly going to be working from home and just kind of maintaining the business and keeping everybody safe at home until we can get the office situation squared away. So that's where we're at as far as the corporate world.
Thank you. Byron, correct me if I'm wrong, but your business that you're in, you have Life Alert. Is it monitoring alerts for seniors? Is it? I believe.
This
medical
is me.
alert, yes.
Oh, you're talking about Byron.
It's
Okay,
the,
sorry.
medical alert devices for seniors, yes.
So how is that? How is this affecting your business and your professional life?
So our environment that we're in is pretty much a call center and distributing equipment to seniors. So pretty much all of our operations have moved to home-based operations right now. We have moved some of our testing and distribution of equipment to operations around the country to kind of spread out our people so that they're not all in one area. And right now we are just trying to maintain regular business. So we scaled back some of the sales initially, but the transition has been smooth. So everything is up and running. All of our monitoring centers are receiving phone calls. So nothing has really changed for our business operate or send out equipment. And if somebody needs to go to a house to install, that creates some problems as far as letting people in your house. But pretty much most of the equipment that we do install can be done right over the phone. So it's really just kind of walking people through the process.
Thank you. And Hal, you deal directly with the seniors club here in Upper Chichester Township. You want to talk about how this has affected them and just in general now?
Yeah, I'll be happy to do that. But first, I'd like to just to mention the fact that, the last 5 years of my working career was involved with developing techniques, policies, and procedures for working with telemedicine and long distance. So it's interesting for me to see those things that I worked on 20 years ago now being used on a day-to-day basis. Now in Chichester, through the Knights of Columbus, which I'm a member of, and as president of the Chichester Senior Citizens Club, we have been communicating with our seniors for the last 2 months and looking for individuals who might need assistance. The good news is that between the church, the Knights of Columbus, and the seniors themselves, what we're learning is that most people are in fact being taken care of by families or by organizations. When we ask if there's anybody who needs support or food or any of that sort of thing, fortunately, I've only been told one person needed some food assistance. Other than that, I think everybody is sheltering in place and being taken care of by family, the way it sounds to me. I am concerned about one thing, and this group, I'd like to open a discussion. When we look at reopening the state, as I understand, when we get to phase three is still recommending that high-risk patients, i.e. primarily all the senior citizens, still shelter in place? Is that a correct understanding of what the phase 3 policy is? Does anybody know?
No, I don't.
I mean, so what I think from looking at green is that there is still a recommendation at that point for high-risk individuals, you know, to practice social distancing as much as possible. Dr. Goldberg, I don't know if you can.
Yeah, I think that recommendation for practicing social distancing will probably remain for a long time, if not close to permanent. But there'll be a line at some point where people make a decision for their own best health to stay in as when they can, and when they do go out, as people will need to go out, to just be careful, wash their hands, don't touch their face, maintain some social distancing, and avoid, perhaps, if they're allowed at some point, very large crowds, gatherings, and other situations that could be worse for them as an individual.
This is an issue that I think is very serious for senior citizens, because the socialization process that you get through the clubs and organizations that do meet regularly, theoretically are not going to be able to meet, because meeting distancing guidelines will be virtually impossible. I don't know how the senior citizens clubs of Upper Chichester or anywhere else can get together under the current circumstances, even through the end of the year, particularly if we have another round of coronavirus in the fall. So I think we have to be particularly concerned about the elderly and their ability to have socialization. Otherwise, they're going to be pretty much limited to their home, except for mandatory shopping trips. So I think that's a major problem that needs to be addressed.
Well, I think how we do on a local level is obviously when things are better condition. The senior club utilizes the township facilities currently closed. But what we could do is, that could be something that we work with the rec director and the emergency management team on, repurposing the space to maybe allow for something like that. So, obviously use the community center. Maybe it's splitting the community center into 2 sections and having smaller interaction in there. Obviously, I don't know what that looks like at this point, but as we get more information and as we continue to move along, I think that it behooves us to kind of work together and work with Brian Warren, our rec director, Bill Robinson, the emergency management coordinator, and to seek out guidance from the county health department on how we can continue these organizations in a much smaller setting.
Well, that's the issue. The smaller setting is a problem, okay? Because if you have an organization, as we do, of 180 members, of which normally get together in groups of 80 to 100 plus, okay? I don't know how you shrink it in order for them to socialize, unless you would break it up into multiple meetings, and then you get down to whose friends are going to come to which meeting. So it's a complicated problem that needs to be thought about. I don't have a good solution, and I've been thinking about it for quite some time.
Yeah, definitely. But I think it'll be something that, like I said, as we go along, we will address, and we'll try to figure out a good solution. But it's a very good question. What does that look like in 3 months? What does that look like in 6 months? What does it look like in a year? I don't have the answer today.
Well, the solution seems to be a vaccine or some type of medical cure that allows people to get back together again and socialize, for the high-risk group in particular.
We'll keep hoping that that's something that comes along sooner rather than later. I think it'd be just to give you guys everybody an update of kind of what's been going on in the township. So at our March meeting, the board declared the emergency declaration. Essentially what that does is it allows for certain items to purchasing requirements. It makes it a little bit easier to be able to purchase things that we need to get by on a day-to-day basis without having to go through all the red tape of a bureaucratic system. It also opens us up to being able to potentially receive funding for expenses that we incur in some aspects. well as activates, gives the authority to our emergency management coordinator to take necessary steps to, stop the spread of COVID-19. The reality is that this is a global pandemic. It's not a Upper Chichester pandemic. So we are really kind of taking a lot of direction here, as not necessarily playing much of a role. Not to downplay the efforts of our emergency management and our emergency personnel, police, firefighters, EMS. They're all doing a great job. They all put themselves out there every day with this. They don't know what type of situation they're getting into while they're out there. Michelle going in and inspecting restaurants. But really from a perspective of, we get a lot of questions of like, well, what are you doing? What are you doing? Well, we're monitoring the situation, and we are as involved as we can be with the county. We're looking for feedback from different organizations, like Hal said, about not really getting a lot of people saying that they need help right now. So sometimes we do get those calls, and we try to field them and get them to the appropriate channel to help people out. And we're kind of monitoring that situation with emergency management to make sure that we don't have a spike in an issue of, food security, homelessness, or any of those things. We haven't seen any of that yet, and that continues, but we'll be ready just in case. From the township perspective, we declared the emergency, and then right away we started with an essential services plan. The essential services plan, continue to provide volunteer firefighters, continue to provide the EMS service, to provide police services, and to provide sanitation collection. So that was kind of the initial services that we said, these are the essential services we have to keep up and running. We closed our buildings to the public. We tried to urge people not to use the public spaces, limited their ability to use the public spaces outside, and kind of went through that. Now, obviously, when you're running sanitation, fire, police, all these, you need a support staff. So our support staff was coming in, our administration was coming into the building, staggered schedules. Some people were working from home, whatever we could do to, social distance. Fast forward to May 1st, that was when the governor opened up construction, and that becomes it ends up being a lot of work for our administrative services once that construction opens back up. So we brought a lot of the staff back at that point to a more regular schedule. We're very fortunate that our lobby is sectioned off from our where our employees are. We're very lucky that we have like kind of a wide open space with minimal staff. So we were able to move around desks and put up partition walls and do some things to keep people away from each other, to where the desks are now separated minimum of 12 feet. Some cases they're about 30 feet away from each other. And we do during the day is we practice social distancing. And then if you're coming in contact with someone or need to come in close contact, obviously we're masking. So right now, as of May 1st, the township lobby is open from 8 to 4. We only allow one masked individual in at a time. We cannot give you any kind of documents. We cannot interact with you outside of interacting through the window. We have a drop box outside where people can put anything in. So for instance, someone needs to pay a business license, someone would like to apply for a permit, put it in there. And then if you need something from us, so you come to the window and you say, I need a voter registration, I need a permit application, I need this. We'll either email it to you or snail mail it to you, depending on whatever your preference is. We've been playing around with the staffing levels and just to kind of see what makes the most sense in the office at the same time. We have our kind of return to work plan all situated for when we need to, go live. Started a department with just sanitation workers and people rotating shifts. Now it's grass cutting season, so we've got some more people in doing that. We've had to do some road repairs, some things like that. So we are ramping up cost. We're not allowing public access to the police department. We haven't been allowing public access to the police department since we started. He has PPE and we have some supplies of PPE that we've been able to procure. Vehicles are being sanitized, buildings are being sanitized. So we're taking all the recommended steps and just kind of, you know, we have to be very fluid with this. Every time I send out an update to the board, I always have in that email that this is a fluid plan and it could change at the drop of a dime, one way or the other. So that's kind of where we're at and where we're going. Hal, did you want to give the group an update of anything from your past couple emergency management meetings?
I think primarily what the emergency management group is doing now is trying to put together an emergency services plan. The emergency services plan booklet apparently was in multiple forms. I guess I'll put it that way. And the job of consolidating that information, and once it's consolidated and a format is created, then putting in the appropriate information into the appropriate sections of the emergency services plan. This is going to take, from what I can tell, some time. I doubt if it would be accomplished in the next couple of months, but perhaps in the next couple of months, particularly when we get back together and can meet in a different format, perhaps that will speed things up, such as the evaluation of the township building as an emergency services center. Obviously, it's not an emergency service center today.
You trying to kick me out, Hal?
Not in the format of a true emergency services building. True. But
Dr. Goldberg and Michelle, did you guys either of you have any updates you'd like to give?
I don't have any updates, but jumping back to what Hal was asking about with the seniors, one thing to think about is the risks relate to, as far as rooms, the size of the room, the length of time you're in the room, the air circulation, and the number of people. So if you could look for small groups, a larger room, good circulation, and small amounts of time, then switching to another group, those would be some things possibly to think about. Or holding whatever could be held outdoors would be one of the best options if that's available.
well, I mean, those are good ideas, and that'll be helpful for the future. My main problem is how do I get 80 people together in small groups? Uh, that's the real issue, because everybody has a friend, and between social distancing and the number of friends that they have, it's difficult to create a meeting format that works. But those are good ideas, and I like the outside idea in particular.
Yeah, I mean, if you have 80 people, even in flu season, if one person has the flu, it could possibly be transmitted, and this is easier to transmit, so, and much more dangerous in that population. So it's a difficult thing, unless, like as you say, there is a vaccine, and a vaccine with a high level of success. Vaccine only works 60% of the time. It's going to be of some value, but to have a large group in a confined area may not be something doable for quite some time.
And we have the group that we're talking about in particular. At last count, we had more than 13 people who were 90 years old or older. The oldest of which was 100, and the average age of the people that are younger than 90 years old is still probably well over 70. So we have a unique problem to deal with in trying to get back together again.
Yep, that's for sure.
And I think that's now, if you apply that one small group to, there's another group in St. John Fisher, a very large group that meets in about a group of close to 100. They have the similar problem. And if you expand that now to the county and the state and the country, it's really a huge problem.
Great, thank you. So the next part of the meeting is open comment. What's going to work is there are people attending the meeting via the phone, so thank you everyone who was able to come in. If anybody would like to make a public comment at this time, on your phone, press *6. It'll unmute your phone. If you then state your name, your address, and then make your comment. We just ask the comments are kept to around 2 minutes. Anybody on the phone that would like to make a comment?
Yes, hi. Are you able to hear me?
Yes, we can hear you. Can we have your name and address, please?
Perfect. Yeah, let me just take it off speaker. This is Sandy Soma, and I am actually the owner of Anytime Fitness Boothwyn. And I really just wanted to comment that when the time is right, we will be very much ready to welcome back all of our local members. We are already one of the cleanest places if any of you on the line have ever visited us. We are one of the cleanest places around to begin with, and we're going to have additional procedures in place. We will space our cardio equipment, or we will shut down every other one so that people are not close. We almost never have more than 8 to 10 people in our facility at any given time. So spacing people out is not a problem. We have high ceilings. We're fairly newly constructed. We have a brand new HVAC system, so lots of very healthy moving air. We already use hospital grade wipes. We have hospital grade disinfectant, and we have a lot of people, including some of our local seniors, who want to get back in for their mental health and their physical health. So we're really hoping this isn't going to take till August or so, but I'm not super optimistic about that, but people's mental health is also affecting them, the isolation. And I think there are some seniors, that would rather take the chance and get out there and be happy rather than stay isolated for another 3 or 4 months. And I think that probably should be their choice. But that's just how I feel about, a lot of it in general. So that's really all I wanted to say. Thank you for having this. I love being a part of the community, but I really do want to get back to helping everyone to stay healthy, and they can do that very, very safely at our facility.
Thank you, Sandy.
You're welcome.
Is there anybody else on the line that would like to speak? Again, it's *6 to unmute yourself, and if you could state your name and your address.
Hi, my name is Casey Goldberg, and I am actually Dr. Goldberg's daughter, and I just wanted to hop on here just to show my support for my father, and he has such a positive outlook on life and things in general, and I'm fortunate to get to see that all the time, and we will stay strong and get through this. Thank you very much.
Well, thank you very much for coming on.
I thank my fan club.
I can assure you none of the Needles children will be calling in tonight. This is great. Anybody else? All right, if there's nothing from the call-in individuals, at this point, we usually go around the room if there's anything else that anybody has.
It's just me. So I'll continue my inspections and let you all know what's going on. But we're kind of like pretty much up to date, except the ones that are closed. So I'll definitely give you any type of update that I hear. Thank you.
Great, Michelle. Thank you.
Mm-hmm.
George, I've been following the statistics of the growth of the virus. And one of the things that I've not been able to find a source for is the number of active cases as opposed to the number of total cases. Is there some area that you can go to statistically to find the number of active cases? For instance, we have 92 cases in Upper Chichester, but how many of those are active?
Yeah, it's a good question. What I could do is I can put a call into the Chester County Health Department and see if they have that on a level, and then fish around on maybe the CDC website to see if that's something that is available from a national perspective.
Because if you look at the statistics, you see them continuing to climb. And I know that you can go to the Department of Health website and state site, and you can see the county data trend line. And unfortunately, the Delaware County data looks like it's relatively flat as compared to all of the other counties in the state. So I'm very curious about the number of active cases, particularly in Delaware County.
I was just looking at a site that showed active cases in Pennsylvania, and there is a decline, several thousand per day to 700, 800, 900 per day the last few days. So there is a decline. And also just looking at a map from one of our local hospitals on admissions, and you do see a nice bell curve that really is dipping down at this point for it, and that's for admissions. Of course, the number of cases is continually going up they do more testing, and once there's a positive
Right.
case, there's always a number that's going to stay there. So it's more the active new cases and hospital admissions that I'm looking at, and they are declining. As far as the caller had called the gym, unfortunately, gyms will probably be in the green phase, the last thing to open. But there is definitely a mental health aspect. You know, we're seeing tons of people, much more than normal, with anxiety, relapses on drugs that they were previously had been free of, and everything else. So there's another component to it as well.
Thank you.
Wayne?
No update for me. Like I say, we're just trying. Everybody's working from home and trying to stay safe. I see the supermarkets are in the township has, their floors laid out and they're cleaning the carts and doing everything they can. I'm just keeping my fingers crossed for the smaller businesses that should be able to open, because all the big box stores are open. So I don't see a reason why some of the smaller stores, if they follow all the rules, not be able to open. But that's just my opinion. But I feel for the situation they're in as well.
And Wayne, just so everybody remembers, Wayne had volunteered to be the liaison to the Recreation Committee for the health fair. Obviously, the health fair is not going to happen.
Right, right.
But I think, when the health fair does happen, I think it's going to be a much different thing than we've had in the past. But
Yes.
I think it'll be very beneficial for the community. So.
Yes.
Darren, do you have anything?
Yeah, I have just a couple of things. We're just going to comment after Dr. Goldberg. We are hearing that the state of Ohio will be opening up fitness centers and gyms, I would say May the 26th.
Wow.
Yep,
And I'm
they
not
just
quite
came out with
sure
that.
when that's going, with Pennsylvania being adjacent, and I imagine that that date for New York and New Jersey would be much later. My question, perhaps one of my questions is to Michelle, is that has there been an additional checklist been added about the wearing of masks in restaurants? Will restaurants, if their employees are not wearing masks, or I don't know, are they going to be cited, or are they going to be receiving a warning? And we do understand that Governor Wolf does have, almost like no shirt, no shoes, no service. If you don't have a mask, you're not getting service. From my understanding, do we see that changing over the next couple of months? I guess it depends on the trajectory and the transmission rates of this virus. But are you seeing that restaurants are starting to ask that question when they're calling you?
Actually, it's the other way around. When people see that they're not wearing masks, they call. They have to. Now, if you read the governor's rule, it's very vague, because if you have a medical condition, you don't have to. But who's asking that? And so it's very vague right now. Will we get more standards? I assume we will when we open up, because of the everybody could be contracted. But right now, the rule is very vague. Yes, they're supposed to. Yes, they're mandated. But it says if you have a medical condition, you do not have to. But with the HIPAA law and everything else, who's asking that question? I went into one last night just because I had to go out to a store, very local, and the employees were. But then some people walked in without them, and I said to the manager, are you enforcing, people walking in here as well? He said, we try to. So I think on the flip side of it, managers are mandating it, but if a person has a medical condition, they don't have to.
Right.
I actually had a complaint in the local restaurant here. Actually went up there. The person that they were speaking to had asthma, and she was like, I can't breathe. So I think they'll probably come out with more stringent rules, but it's enforcing them is one thing, and then knowing about a medical condition is another. The governor's rule doesn't say what type of medical condition. So,
Michelle, do they have the right to deny them entry, even if they have a medical condition? I mean, that they say they have the right to deny entry, but if they have a medical condition, what's the rule on that?
Right. It's very vague. It's very vague.
Yeah.
I saw one place had a sign posted something to the effect of, we want you to wear a mask, but if you don't wear one, we will presume you have a medical condition.
Right.
Under HIPAA, we can't ask you about your medical
Exactly.
condition. So come on in.
Exactly.
Yeah.
How about you, Byron? Did you have anything?
So I was just concerned, thinking about the local businesses and when things are going to reopen, if there's any sort of resources that we're providing to them or guidance as far as precautions that local businesses can take.
Yeah, I mean, everything at that level is coming from like the CDC, which is being pushed out through the county health department. Daily, we get kind of like what we talked about when we went through our pandemic, that there'd be lots of sources of information coming in. I get probably about 100 emails a day of the different types of things people can do. 50 of them are companies trying to sell us posters or other things to try to, boost their bottom lines. And then some of them are really come from good sources. So basically what we're doing is we're pushing along what we get from like, the Department of Community and Economic Development, the County Commerce Department, the County Health Department, Pennsylvania Health Department. When we get information from them, we try to get it out as soon as possible. I'm not sure if Barbara Kelly is on this on the call, but Barbara works directly with the Business Association in efforts to get them information as well. So there is stuff going out to those individuals.
I have a quick question, George. Masks. Where do people get masks? I haven't seen them anywhere. I see people wearing them. I'm trying to figure out where are they getting them. Is it somewhere that you know of, or is the township buying or know of where residents can get masks who need them?
So to be honest with you, I don't think there's I'm starting to see more and more sources come online of advertising that they're selling masks. Mm-hmm. But I think there is a lag time from when this all started to when there's going to be a mass production of it. PPE, the township has the ability to order certain like N95 masks or KN95 masks, things like that, or like as far as like the fabric masks, I know some people, have been making them for themselves, making them for family members, but I haven't really seen anywhere where they've been like mass produced and marketed.
You can go on Amazon and order masks. It'll take a week, maybe 2 weeks to get them, but you can go on Amazon and get masks.
Yeah, several weeks ago that wasn't an option, but if I haven't looked for a while, but I'm just asking for the residents who have a problem, because I had a problem early. If I didn't have any already on hand when this started, because I've used them for various things around the house, I wouldn't have been able to, go out.
Yeah.
George, I have a quick question too. June the 2nd is election day. Is the township opening up the township building and the community center for polling places?
Yeah, so how all of the polling places in Upper Chichester have stayed the same. There's been no change to our polling places. The county has said that they'll provide the poll workers with PPE, and my understanding is that the process will be that you will get a paper ballot and handing in a paper ballot, that you won't be going to a poll machine.
No, they're going to use ballot boxes, right?
Yeah. So all the polling places will be the same here in Upper Chichester.
Okay.
And I'll finish up. The only thing I have is just the numbers that I read off the county's website today. That today there was 94 cases in Upper Chichester as of so far. There's 94 cases with 4 deaths. We don't get that information. A lot of people call me and ask me all the time, "Where's this? What's going on? Where's it going on?" We don't get that information. It's not something that the county shares with us. Talk to them on a high level of, if what if, but again, they've assured us that they have people in place to assist at all levels if need be. So we just are kind of staying and just trying to do the best we can with the information that's available. But right now it's really about just kind of sharing the information, and if people could just check on their neighbors, check on the elderly, So with that, I guess the last thing we would need is just a motion to adjourn the meeting.
Motion to adjourn.
Second.
Okay, we have a motion from Dr. Goldberg and a second from Michelle. All in favor?
All right.
Aye.
All right,
Thumbs up.
everybody, it's been a pleasure.
Thank
Good
you.
to see everyone.
Thanks for being the guinea pigs on this. You all did a wonderful job, and we really
Have a
appreciate
good night.
Two other meetings tonight. Good night.
All right. Thank you, George.
All right. Take
Right.
care,
Thank you.
everyone.
Everyone.
Take care.